Good afternoon and welcome to our Oak Bend Medical Center Happy Hour podcast. My name is Donna and I am your host. I'm very excited to introduce our guest who happened to have already been on our podcast and excited to have him back as we speak about Group B Streptococcus, otherwise known as GBS, in the perinatal period. Dr. Joel Bonaparte is a double board certified in pediatrics and neonatal perinatal medicine. He completed his residency at Weill Cornell Medical College, Lincoln Medical and Mental Health Hospital, New York, in fellowship at John Stroger Jr. Hospital of Cook County, Chicago, Illinois. His passion to provide the ultimate standard of care for over 15 years, both in the clinic and the NICU, has been his philosophy of practice. He has been the president of Sunrise Neonatal Associates and neonatal medical director since 2017. He is dedicated to taking care of the full spectrum of sick and well newborns to adolescents. Welcome, Dr. Bonaparte. We're happy to have you back.
Thank you so much, Donna, and I'm very excited to be back on your podcast. I think this is very instrumental in getting our messages to the population. So I'm very happy to be back.
Last we recalled, we were talking about a NICU that we have at Oak Bend, and we got a lot of positive experience. So we wanted to bring something that a lot of us probably don't understand or know and have Dr. Bonaparte explain. So, Dr. Bonaparte, what is Group B Streptococcus or GBS?
So Group B Streptococcus or GBS is a bacteria, it's a gram-positive bacteria. And what makes it so important is the most common cause of disease in the newborn infant. We all know newborn infants have a weak immune system, and several bacteria and viruses could cause diseases. But GBS, which is Group B Streptococcus, forms about 45% of the isolates. So it is something that is so important to talk about. And then stemming off of that is a very important experience we have all the time. There's a misconception in the community that it is an STI or STD, which is a sexually transmitted infection. And this is far from the truth. And I think if anything picked out from this podcast is of importance, that's the main thing, because we go into parents' rooms and we have confusion sometimes. So I just want to set it clear that it is not an STI, it's not an STD. Group B Streptococcus actually is a normal microbiome in some of the mothers. About 10 to 30% of them could be found in the GI tract or the GU tract.
Okay, so it's something that can just hang around.
Yes.
Okay. What happens if a mother does test positive when she goes to her OB and that?
Okay, so that's a good question. And very importantly is the fact that if the mother is positive, there's a 50% chance that the baby will be colonized. So like I mentioned earlier, 10 to 30% of mothers will be positive at some point in time in their pregnancy for no fault of theirs. It's not STI, it's not STD, it just so happens. Out of those 10 to 30%, 50% of the babies born to those mothers will be colonized but not infected. And then 1 to 2% of them could present with early onset GBS disease, which means those babies will be sick and have symptoms that we'll be talking about. So if the mother is positive, which is so important during the pregnancy, because it is done, this testing is done during 36 to 37 weeks gestation. Even with COVID, some mothers were not going for regular appointments. Some dropped off the wagon a little bit, but this is a very important point to emphasize that it's so important you continue your prenatal care because this testing is done between 36 to 37 weeks. And if you're positive, you're offered antibiotics intravenously in the hospital, which could help protect your baby from getting this disease. Some obstetricians do this test and fax the results to the hospitals, which is a great thing. Now, we all know that some mothers will go into labor prior to the due date. Some will show up on a weekend and the results might not be available. So it's so important that the mother is informed and asks the OB questions and knows that she's positive before she comes into the hospital. So then we can offer her the antibiotics to protect her baby. If the mother is positive and goes into labor, As soon as they get to the hospital, we start them on IV antibiotics, specifically penicillin or ampicillin. And research has shown that if the mother gets the antibiotic 4 hours prior to the baby being delivered, it reduces the colonization by 97%. So you're actually protecting your baby. Sometimes the mother will come in and won't have the 4 hours, could get the antibiotic 2 hours. And research shows that even 2 hours has its benefit. Those that got less than 2 hours worth of antibiotics, those babies are monitored more closely. We do vital signs more regularly and typically watch the babies for 48 hours prior to sending them home. I'd just like to expound on that a little bit because we also have problems when we're explaining to the parents sometimes that the mom is GBS positive, baby looks good, baby's feeding well, and then we go into the room and say, hey, you can't take your baby till tomorrow when the baby's 48 hours. And the reason for that is research has shown that babies that are going to show early onset disease or get sick typically do that within the first 24 hours. However, by 48 hours, 95% of babies that are going to be sick by GBS will be picked up. So it is very prudent that we watch those babies closely, and it's for the sake of the baby. So at 48 hours, the baby looks good, feeding well, no temperature instability, and baby is safe to go home. You know, the parents are going to be real happy that there's a less likelihood that that baby could get GBS when they go home.
So does a pregnant woman show signs of symptoms of GBS?
So GBS typically in the female, those that are colonized will not have any problems. But that being said, some could have a UTI, which is a urinary tract infection. Researchers shown that those that have UTIs are actually heavily colonized and have a higher risk of getting the baby sick if they don't get the antibiotics. They could also have endometritis and then have inflammation of the sac around the womb. The mother could get some sicknesses from GBS.
Okay, but would she know if she had it in any way or prior to the test, or is it pretty silent?
Yeah, it's pretty silent. And if she has a UTI, the OB will pick it up on their routine urinary screen that they do. Or if she's symptomatic, they'll always do a urine culture as well. So most of the time, it will show that she has some symptoms that could be picked up. But this is still pretty rare. Most of them have no symptoms at all.
Okay. So it's important to talk to your OB-GYN and know about your test and be familiar with it. What is the difference between early onset and late onset GBS infection?
So early onset disease, when it comes to GBS, we're talking about the first 7 days. So if a baby gets sick within the first 7 days, we call it early onset disease. And everything I've talked about giving the mother the antibiotics, which is classically penicillin, ampicillin, or Ancef when they come into the hospital when they're positive, prevents or reduces the incidence of early onset disease. It does nothing to late onset disease. And late onset disease is actually after 7 days, up to 2 to 3 months. The differences here are early onset disease typically is an ascending infection from the vaginal tract going upwards. If she's already ruptured or there's any breach in the membranes, the baby could get infected, or vertically when the baby is coming out, being exposed to the vaginal area, which is already being colonized with GBS. The baby could aspirate some into the lungs or into the mucosa and then show signs and symptoms later on. Late onset GBS is a little different. That's more horizontal, it's more community acquired, and it's not typically from the mother's GI tract or her GU tract at all. So it is very different. However, the symptoms are pretty similar and the treatment is the same.
Does this affect mothers who have had a C-section or plan to have a C-section?
That's a very good question. So GBS in a mother that's planned to have a C-section typically will not ascend and cause any infection in the newborn if she has not gone into labor. So the caveat there is that if she's in labor or she has leaky fluid or in that she's already ruptured, then she will also have to receive the antibiotics, which we call intrapartum antibiotic prophylaxis. The reason for that is once there's a breach, there could be an ascending infection. If she's in labor as well, you don't always pick the breech, but once she's in labor, there could be a tear somewhere and she could get infected. So if she comes in, there's no labor, no rupture of membrane, she does not qualify for any antibiotics, the baby will be totally fine. But if she does have labor or has ruptured, then she'll have to receive antibiotics, and the baby's at the same risk as a GBS positive baby that is being delivered vaginally.
So what would you tell mothers? Because I know we're going to have some mothers listening to this, and now they're going to put that on the list of worries for the 5 fingers and the 5 toes and everything else. What do you tell mothers? What ease their mind?
The good news is research has shown that given these antibiotics has done a big help in reducing the incidence of early onset disease. Back in the 90s, we used to have 1.8 per 1,000 having GBS early onset disease. Since the CDC started universal IAP in mothers that are positive since 2002, a study done in 2015 showed that it had dropped to 0.23% per 1,000. That's an 80% drop. So the good news to mothers is if you're vigilant, you're positive, you come in early and we get the antibiotics going, the chances your baby is going to be sick is really, really small. And then the second thing is that most of them would show signs and symptoms within the first 48 hours. And most hospitals, actually all hospitals, are well geared towards that. The nurses will do frequent exams of the baby. They look out for things like temperature instability, respiratory distress, poor feeding, lethargy. And if there's any sign of that, your baby will be whisked to the NICU immediately and antibiotics started. So because of all the reports out there, there's a lot of vigilance and the incidence is much less than it used to be. So that's good news to the parents. I still emphasize that you really need to know what your status is between 36 and 37 weeks. If you haven't seen the doctor because of COVID and you're just waiting to go into labor, I don't think it's a good idea. Please call and try and get an appointment. Make sure your GBS is done. It is just a simple swab from the rectum and the vaginal area sent to the lab. Results typically come within a couple of days. And then after it's done, make sure you follow up with your OB and try and get the results. So when you come into the hospital, we know exactly what to do.
That's a great idea. And then I want to re-emphasize it's not an STD, because I can see we hear the words and we think that immediately. It's not an STD.
Very, very important. And we always have that issue when you go to the room and you're telling the parents that something was positive from the vaginal tract and you see the eyes all open wide. But it is not an STD and not an STI. And another important thing to mention is, although it could be treated with IV antibiotics, some mothers have tried using chlorhexidine douches. They've been trying PO antibiotics, and all the research has shown that that doesn't help. The only thing that reduces the incidence of colonization in the newborn would be if the mother comes in early and gets the IV antibiotics, and specifically penicillin, ampicillin, and onset. A few mothers would be allergic to penicillin and ampicillin, and there's a cross-reactivity with onset as well, being a cephalosporin. So the next line would be clindamycin. And with clindamycin, there's a 42% resistance of GBS. So all clinicians are well aware of this. So pediatricians and neonatologists would be extra vigilant in any baby that the mother received clindamycin as the antibiotic of choice because of her history of some degree of reactions to penicillin or ampicillin. So the good news is if you come in early, you have your results, we have a good chance of reducing your baby's chances of getting sick.
So in other words, moms, dads, you'll make sure you do your prenatal care. It's very important. And know your results.
Yes.
It's a big help to the doctors.
Yes, it is. And it's a big help to the baby too. So you take home a healthy, happy baby.
Dr. Bonaparte, in closing, is there anything else you want to add?
I'll just say that because of COVID, I've seen a lot of hesitancy of mothers trying to go for, and I've said it, I just want to emphasize that please go for your appointments. Please go for your appointments. And that's the only way you can really be sure you're going to have a healthy baby in the long run. So try and make those appointments and get vaccinated too, because the research has shown that pregnant moms, it is safe to get the vaccines and the outcome is good. I have several people saying they don't want to get it because they're trying to get pregnant and they're scared of infertility. And what I tell them that you need to be alive to get pregnant. So get the vaccine so you can stay alive, get pregnant, and then we'll take good care of your baby.
Awesome. That is very important. It's a new world out there, so we need to make sure that we take care of ourselves and do what we can to be here for our babies for a long time.
Yes, it is.
I want to thank you again, Dr. Bonaparte, for joining us. You always give us some great and valuable information. And today I also want to give a big thank you to our listeners for tuning in. Beginning now, set an intention and a relentless focus on living your life as the greatest person you can be in all situations. Please join us next week.
Thank you for joining us today on Oak Bend Medical Center Happy Hour podcast. We hope you enjoyed today's broadcast and invite you to email us at oakbendhappyhourpodcast@obmc.org with any questions or topics that you would like for us to cover. Remember, you can find us here each Friday at 5. Until next week, be mindful and stay healthy.